Hi, my name's Cannady. I'm a nursing student at St. Francis. I'll be taking care of you and your baby today. So I'll perform hand hygiene, and then I'll get my baby's patient identifiers with his armband, and then I check it against the EMR or the crib. First, I'm going to get his vital signs. His temp should be 97.5 to 99. His pulse should be anywhere from 100 to 160, and then his respirations should be 30 to 60. So we're just going to go ahead and uncover my baby a little bit, just enough so you can get in there. And then you want to listen to his respirations and then apical pulse for a full minute. And then while I'm here, I want to listen to my baby's bowel sounds in all 4 quadrants. And then I also want to go ahead and palpate the abdomen and then note if it's like distended, round, and everything like that. So then I'm going to go ahead and cover him back up, and then we're going to go back up to the head. So with the head, you're going to note like the fontanelles, you're going to note with if he has molding, if the suture lines, you're going to look for capus succedanea, I can't say the word, but it's basically fluid on the head that encompasses multiple sutures. And then the other one is the hematoma. It's actually blood just on one suture line. So you want to note any of those. You want to note any bruises, scratch, or nicks from the birthing process. So then after that, you want to go ahead and go down to the baby's eyes. You want to note for any hemorrhaging in the eyes and the sclera. You want to note any discharge. You want to make sure they're symmetrical, and you want to make sure they're in line with the ears. So then if you go down, you want to make sure that the ears are in line with the eyes, and then you want to go ahead and fold back the ear real soft, and then let it go and check for cartilage recoil. Next thing you would do is you check nair patency. So you cover one nair and then feel the other one, and then vice versa. This time you'd go ahead and put on gloves, and then you'd run your finger across the baby's cheek so he'd open his mouth. Go ahead and feel the palate in his mouth for like a cleft palate or something along those lines. Make sure it's closed all the way, and then you also check for the sucking reflex. So after you're done there, you want to go ahead and open up the blanket just a tiny bit. You are going to go ahead and feel the baby's neck for masses. You want to grab a hold of the baby's head and check for range of motion. Go ahead, open them up a little bit more. Go ahead and check the clavicles for if they were broken during the birthing process. While you're here again and you have his shirt open, you want to check for the 5 signs of jaundice. So you start with the forehead, the chest, the abdomen, then you go to the thighs, and then after that you go back to the eyes and check the eyes last. So go ahead, we're going to cover him back up there, and we're going to come down and go to my baby's genitals. I still have gloves on. So my baby is a boy, so here you see if he's circumcised or uncircumcised. Palpate the testes to see if they've descended. Note if there's rugae on his testicles. For the female, you would look for edematous on the labia. Make sure that the labia cover the clitoris, and then you'd also note any discharge. So go ahead and cover him back up. So before we move down, we're going to go ahead and check the umbilical cord and look and note any drainage, if it's dry or red or anything like that. So go ahead and cover that back up, and then go ahead and go to his feet. So here you would want to note how many toes he has. You'd also want to do that the same thing for his hand, and same thing with the creases, how many creases he has on the soles of the feet and the palms of his hands. And then you also check for Babinski's sign. So you just drag your finger from here all the way on the outside of his foot, and his toe should flare out. So cover him back up. One last check before we flip him over is the reflex sign. So go ahead and take your baby's arms and fold them up towards him, and then hold him down, and then let go, and his arms should come back up towards him. So then we're gonna go ahead and flip baby over. You wanna support his neck in that process. And you wanna look at his spine, and during this whole assessment, now that I can see his back, now I can know for sure if he has any vernix, any lanugo, any scratches, bruising, anything like that along the body. Now, if you look down here, you wanna look for any dimples or tufts of hair that can spina bifida. So now that you want to limit the time on the stomach, go ahead and flip them back over and get them covered back up. And then the last thing you would want to do is you'd want to check for the 5 signs of respiratory distress, which are grunting, seesaw breathing, what are they? Nasal flaring, apnea for greater than 20 seconds, and retraction. You'd also want to see how he tolerated everything. If he was crying, you'd want to note that. You'd also want to talk to the mother about last time he voided, next time he needs to be fed, and then you'd also want to do one more sign where you pick up the cradle or clap really loud and see if his arms come up near his face. That is a reflex that all babies should have. And that is my infant assessment.